Good morning, everyone. It's Thursday, August 12th. Welcome to the Morning Medical Update. I'm Jill Chadwick, in for Jessica today as she drops her little one off to the first day of class. I think he was a little bit traumatized today, and that makes Mom a little traumatized, too. I understand that. Coming up, Jessica, like a lot of parents and grandparents and caregivers, are a little anxiety-ridden as thousands of kids go back to classrooms this week with some unknowns ahead of us. Our experts have good advice as we tackle the start of another school year, plus how the pandemic has impacted yet another aspect of our health, and it's your eyes. You're going to learn some things this morning that you may not have heard before. But first, Dr. Hawkinson joins us with the COVID count. Good morning. How are the numbers looking?
Hi. I'm good. Yeah, I mean, there certainly seems to be ramping up a lot of consternation and anxiety and anger about having children wearing masks. So, I don't envy those people who have to make those decisions, whether it's in those institutions themselves or in the school districts themselves. Certainly, they have a lot of influences that are playing on those decisions. Today, the numbers are, they were a little bit higher overnight. We do have 47 active infections with 19 in the ICU and 11 on the ventilator. We still have 15 additional patients in that recovery period as well, so 62 total. Hayes has 8 active and 1 in that recovery period as well. So numbers creeping up just a little bit. I'm hoping, when we will see some plateau in cases and hospitalizations. Obviously, we know hospitalizations do lag behind cases, but just keep getting out there. We'll see how things go once school starts. We know that schools can be opened safely if the right things are done, and that children and the adults in those schools don't spread it to each other during the school times. Obviously, when they get out of school and in those other situations is probably the riskiest point.
All right, thanks. Don't go anywhere. Do we have reporter questions on the line?
Oh, sure. Hi, it's Cody with Channel 9. I got a couple for you, Doc Hawk. This one just came out of the blue as you mentioned masking. I'm curious, part of the argument is, it's hard to keep them on kids or whatever. Is there a specific kind of mask that doctors are recommending for younger people to wear that might be more comfortable? Or is it just a face covering is a good face covering?
No, I mean, I don't think anything has changed since a year ago. We have had some pediatricians on the show. We have had psychologists on the show. We happen to have a very good one today. And all of them recommend, really any mask. And the issue is, children otherwise do very well with the mask. I don't believe, and I'll be corrected by my colleague here in just a little bit, I don't believe that there's been any sufficient data suggesting that children have significant anxiety or problems wearing a mask. I think in the general, they do it a lot better than adults do. In fact, they even wear playing sports, which I know I could not do any activity, even if it's just walking outside wearing a mask. So they tend to do it a lot better, a lot easier. There are concerns about masking causing more illness because maybe it's dirty. I think what our pediatrics colleagues will tell you and Children's Mercy will tell you is that they didn't see a lot of people during the height of the pandemic when everybody, including children, were wearing masks at school. We didn't see people coming in for pneumonias or other respiratory viruses. Really, it wasn't until the masking stopped that we saw more transmission of illness throughout. So, no specific. I think still just those cotton masks that you can buy anywhere. Certainly, we know a lot of either grocery stores or pharmacies are also selling surgical masks. Those are reasonable as well. And in other places, if you can buy KN95s. But I don't think there's any specific type, and I don't think there's been any new guidance that you need one over the other.
All right, do you have a follow-up question?
Yeah, CDC yesterday strengthened the call for pregnant women to get their coronavirus vaccinations based on new data, and I was curious if you could just expound on that a little bit and why they're making that decision.
No, I think it's that simple. I think they, number one, looked at the increased risk of if you are pregnant compared to if you aren't pregnant, and those women that are pregnant do have a slightly higher risk of having more severe disease and going to the ICU. So that played into it as well. And we also are getting more information that you do have some transfer of antibodies from mom to baby through the placenta, prior to giving birth, which is important. So I think it was based on that, as well as the incredible safety profile that they did see when they were able to analyze pregnant women who did get the vaccine.
And I might just add that we're going to have Dr. Alt on tomorrow, who's with the CDC ACIP committee, and he's also an OBGYN, and he's going to talk in depth about that issue. So do you have another follow-up?
Oh, I'm good. Thank you.
Okay,
Thanks.
we do have one from KCTV5, and they wrote in this morning, and they said there's a couple of local Olathe doctors writing mask exemptions for kids for school. What's your reaction to this, and what would be your advice to such doctors? Is this a bad idea?
Yeah, I would always defer to my pediatrics colleagues for this. However, we know that there are, in some cases, there are subpopulations of pediatrics who do need, for one reason or other, legitimate reasons, do need to go mask-free. But in general, most all of the children can tolerate the mask, and I think this kind of goes back to the individual health, that individual patient and their doctor in making that decision. I don't think I can say anything other than that, but in general, masks have shown to be very safe and effective and very tolerable for these children. So I think it kind of goes down to the individual and just really understanding why that mask exemption is being written. Can't really comment on it if it's legitimate or not, because we don't always know all the details of that doctor-patient relationship.
All right. Well, thank you, Dr. Hawkinson.
Yeah.
We are now going to turn to our guest today. Our ophthalmologist, Dr. Annie Wishna, is here to discuss eye health, and clinical psychologist, Dr. Greg Nowalnik, I know your name, here with some back-to-school advice. Good morning. I want to start off by saying that you sat down today and we were visiting, and you said some ophthalmologists are calling this the STI pandemic.
Yes.
What is that?
Yes. Well, so STI is when there's a blocked oil gland in the eyelid, and then everything kind of blocks up behind it. There's natural oils there that are part of the tear film. So it's kind of like a pimple in the eyelid. You can get lid swelling, a red eye. This can be painful and uncomfortable. And I do think that it's related to stress. So we all know we've had added stress with the pandemic. So there's been more STIs. The best treatment is really to put warm compresses on it for an extended period of time. My little trick is to get a washcloth wet and put it in a Ziploc bag and then put it in the microwave for about 20 or 30 seconds. Then seal the bag closed, and then that'll stay hot for a long time, because if you just put hot water on a washcloth, it'll be cold in about 2-3 minutes. Then you want to do that 20 or 30 minutes at a time, and 9 times out of 10 that'll take care of it, and there's no need to get medical attention right away. But if it's not getting better, it's getting worse, there's a lot of swelling, any change in vision, double vision, then it could be something more going on, and I would recommend getting it checked out.
So you take the plastic bag and you seal it after you've warmed it, and you just put the bag and everything on the eye?
Yeah, I'll usually wrap it in a thin towel, like a kitchen towel. You don't want to burn your skin, obviously.
Right.
But then it'll stay warm for an hour or so.
Okay, so let's just cover some basics right now. And at the very beginning and throughout this pandemic, when we've ever been on traveling on planes, and Dr. Hawkinson is one of the people that has taught us that we want to wear eye protection. Can you get COVID through the eyes?
You can. Your eyes are a mucous membrane, just like your mouth and your nose. So if COVID particles land on your eyes, you could get COVID that way. So when we're seeing patients in the hospital, that's why we wear eye protection. These are my safety glasses. I actually flew this weekend, and I wore these along with a mask. And usually, I do it at work all day, but if I'm in close contact with people indoors for extended period of time, it's a good idea to have eye protection. So, if you can reach out and touch a stranger and you're going to be in that position for more than 10 or 15 minutes, it's a good idea.
What about contacts in COVID?
So it's fine to wear contacts during COVID. I actually wear contacts. The concern is just you don't want to touch your eyes, because if you had COVID particles or anything else on your eyes for that matter, it could get in the eye and cause an infection. But just if you avoid touching your eye, there's no problem to wear contacts at all.
And one more basic, if we wear glasses, like I had to put mine on because I can't see up close, how do I keep that from fogging, my glasses from fogging when I wear a mask?
Yeah, so there's a couple little tricks. I've got my mask right here. Like one thing you can do is just flip the ear loop around like that, the opposite way. Sorry, having trouble showing that. But so then that kind of helps vent it down a little bit instead of up into your eye.
Right.
Also, if you make sure that the bridge of your glasses is like kind of tucked, your nose is kind of tucked under the bridge of the glasses, that also kind of creates a seal and keeps it from fogging up. There are anti-fog sprays that you can buy, or even just doing a little bit of water and dish soap and letting it dry can help prevent your glasses from fogging up.
Those are all
it
really
is annoying.
It is. Those are all great tips too. Let's talk about COVID eyes and health. How does contracting COVID impact eye health? Are you seeing anything?
I mean, it's rare, but it certainly can happen. Basically, COVID can cause an immune response, or it can cause blockage in blood vessels. So that's kind of how COVID causes problems throughout the body. So it's the same thing in the eyes. So it can cause inflammation in the eye, inflammation of the optic nerve, blockage in the blood vessels, in the retina. So it's pretty rare to see, vision-threatening complications like that due to COVID, but we have seen it, and unfortunately, we've seen a case at Children's Mercy that was both eyes and a child that did lose vision. So while that's rare, it does happen. And also conjunctivitis can be a symptom of COVID as well.
Is that pink eye?
Pink eye, yes.
Okay. So if we get pink eye, should we be tested for COVID?
I think so. I mean, I test all my patients with viral conjunctivitis for COVID. Just because you have a red eye doesn't mean you have viral conjunctivitis, but the symptoms would be like red eye. Usually it'll start in one eye and then go to the other. Kind of your eyes stuck shut in the morning. You might have swollen lymph nodes right here. And you probably would have other upper respiratory symptoms like a stuffy nose, runny nose, cough, or, of course, if you have other COVID symptoms. But every patient I see with viral conjunctivitis, I do test for COVID.
Okay, so I went and got my annual checkup for my eyes, which I know you would highly recommend for kids and adults. And my eye doctor had to bump up my prescription, and it surprised me. And he said, "Oh no, I'm seeing it a lot since the pandemic." I asked him why, and he said, "Too much screen time." Is that?
I personally haven't seen that as much. I mean, it may be